I think it's really important that pharmacists are able to discuss the primary goals of treatment with any of these agents. The other thing it's important for pharmacists to counsel is to review what is the goal for the patient and to put everything into perspective. There are no quick fix agents. There are no pills you can take without diet and exercise that are going to reduce weight. Each one of these agents were studied with a calorie-restricted diet and exercise. Most of the trials had 150 minutes of exercise, weekly exercise. Most trials did a 500 calorie reduction deficit diet plan, which meant if they normally were eating 2,000 calories a day, they reduced it to 1,500 calories or vice versa. Some trials included as low as a 1,200 calorie a day diet. So whether you were in the placebo group or whether you were in the treatment group, you were enrolled in their diet and their exercise plans. The only difference that happened was the use of the med or not use of the med. Even with that said, any of these agents, the most that was seen in terms of average weight loss was 5 to 10%. So we're talking 5 to 10% of actual body weight. If you're 300 pounds, we're talking a 30-pound reduction at 12 weeks. So during those 12 weeks, a reduction of 30 pounds. It's really important to set that into perspective for patients and to educate them that this is not a miracle loss, and patients would be expected to lose 5 to 10%, and that would be a real benefit for the patient. And that's really kind of the weight loss that you're going to see. Even looking at 2 years out for some of these agents, you're looking at a loss of maybe 5 to 8%. with an additional added loss of another 5%, so a cumulative loss of 10% over a 2-year period from baseline, which in perspective, we're talking, 15 to 30 pounds for a lot of these patients. These agents are great and a lot of times can be used as the jumpstart patients need to help them jumpstart their weight loss, but it most certainly won't be maintained if there are no changes in their diet or their exercise. And that's really an important thing. It's an important concept for pharmacists to be able to communicate with patients, and it's an important thing for patients to be able to understand and know this going into taking the medication, that other changes in their diet and lifestyle are going to need to happen with starting the medication.